today we're going to talk about how to use Amplimune in your stocker operation or even a feedlot operation. There's a lot of questions in the cattle industry, and some of it is when you receive new cattle from a sale barn, they're going to be stressed, right? And it's not the sale barn's fault, it's just the nature of the beast. You mix a bunch of cattle together from different origins, they're going to get sick. But the question is, so do I vaccinate them? When do I vaccinate them? Do I use a control treatment of antimicrobials? Do I not use it? Do I pull and treat? But the interesting thing about Amplimune is it's going to stimulate immunity and decrease inflammation. So that's needed for whatever problem you're looking at or when you want to use it. But I would use it at the time when you're running through the chute at vaccination or when you're giving them control antimicrobial treatments, the best time to use it. And usually that's a few days after you received them. That way you let them settle. Or if you're having to run them through the chute immediately, still give that shot of Amplimune. So stocker cattle, they're under a lot of stress because even if they've been weaned for 30, 60 days, hopefully 60 days, they're still in a different environment. And that's really stressful for cattle. So you're going to get in stocker cattle and it's hard to find enough of them from just one source. So you're mixing them all together. It's like the first day of kindergarten. I mean, your kids come home sick, and same way with these cattle. It's very stressful for them. They're usually eating a different ration than they're used to, and they're around different friends that they have never seen before. You know, it seems like whether you're raising smaller cattle or stocker cattle or starting cattle or to feedlot, our problems are still similar. It seems like it's BRD or pneumonia, the worst problem we have, or the most costly problem. And in my experience, Amplimune can be used at any time during that period to stimulate immunity and decrease inflammation. BRD causes a lot of inflammation in the lungs because when those gram-negative bacteria die, they release endotoxins, and that causes a lot of lung damage. Or when we use antimicrobials to treat bacteria and kill the bacteria, they still release those endotoxins when they die. So anytime we can decrease inflammation and increase immunity, it's got to be a good thing. So if you're interested in mycoplasma, which most cattle producers are, there is some interesting studies that were done on Amplimune against mycoplasma. So Amplimune needs to be stored very similar to a vaccine. It needs to stay refrigerated, but it can undergo short periods of time where it's not under refrigeration. It also has a 21-day withdrawal, which is the shortest period of time allowed by the USDA is 21 days. So Amplimune is sold in a protected container, so it's not broken in when you're storing it or when it's shipped, but you should always shake it before using it. It'll look kind of clear when it starts out, but you want it to look like a kind of maybe a skim milk color before you use it. The mycobacterium technology, there's other uses for it in the United States. Mammary tumors in dogs, viral pneumonia in horses, metritis in horses, and also sarcoids in horses. So there's other uses for it, but all of these take immune stimulation or immune modulation to work. Not a prescription product, but it's still always a good idea to involve your veterinarian in the conversation when you're trying to make animal health decisions for your cattle. In summary, there's a lot of research involved with Amplimune, including many peer-reviewed articles. So I encourage you to do your own research, but Amplimune should be considered in your herd health program to help reduce morbidity, mortality, and scours, which ultimately will improve your bottom line.